Hi, my name is Joel Amos, and I am a aortic survivor, many times over, actually. Before all of this was found, I was a very happy movie and television entertainment journalist. I traveled the world covering world premieres and talked to the world's biggest stars, from Harrison Ford to Sandra Bullock to Martin Scorsese, Spielberg, you name it. And it was, in fact, on a job. I was on a movie set in New Orleans in 2015, day before St. Patty's Day. Had never been there before and was very excited to spend St. Patrick's Day in New Orleans, of all cities. But fate had other ideas. On March 16th, about 4 o'clock in the afternoon, I felt like I got kicked in the chest. I know a lot of people know this feeling. I lost the feeling in my legs. I thought about taking a nap, was my first instinct, but then I said, no, this is not normal. I called 911, and remarkably, the EMT, I believe, saved my life. She ran an EKG and she said, you did not have a heart attack, but this is definitely something seriously wrong. So I had emergency aortic dissection surgery. I had to call my wife and say goodbye at the insistence of my doctor, but I survived. I woke up. Last thing I thought before I went to sleep is I will wake up, and I did. And that was very challenging, but I got through it. A year later, believe it or not, I had to fight to get a CT scan, which is what the doctor had ordered. I finally landed with a doctor who believed in prevention, and so I had a CT, and sure enough, it showed a 6.2 centimeter aortic aneurysm. So back we went to open heart surgery, but this was very different. It was a planned surgery. So those of you out there having planned surgery know that it's I don't want to say it's a lot easier because nothing is easy, but it was certainly less painful upon awaking. And having a cardiac rehab helped a lot. And then I subsequently had 3 or 4 stents put in, different surgeries. I was living in Los Angeles and felt that between my young daughter and my health, it'd be nice to move somewhere where we had more room, where we had a backyard, a front yard. So we moved to Spokane, Washington, which is where I'm talking to you now, and got set up with a vascular surgeon and a cardiologist and got all my ducks in a row. And lucky me, after having 4 or 5 surgeries within a 2-year period, I hadn't had a single surgery in 6 years. So I felt extremely lucky, extremely blessed. But there was a abdominal aneurysm that we were keeping an eye on, and it was at 5.5 centimeters. And believe it or not, 2 years ago, it came back at 5.2, and my surgeon was like, "You're a miracle. This doesn't happen. It doesn't shrink." But again, fate felt like, no, now's your time. And my most recent CT scan, taken back in late May, early June, showed that it had jumped to 6.4 centimeters. And what's worse is they found major issues with my aorta in general. My surgeon here in Spokane felt that it was smarter to go to a surgeon that does this every month or every week. And to be honest, he said that I had never done this surgery, and I don't know anyone here who has done this surgery. Well, lucky for me, I had a great relationship with my vascular surgeon in Los Angeles. He, since I discovered, had been promoted to the head of vascular surgery at Cedars-Sinai, which also had just been anointed the #2 surgical hospital in the nation. I sent the CD-ROM to him. He looked at it and he said, like the price is right, come on down. So we made arrangements for me to fly to Los Angeles. And lucky for me, my best friend in the world lived there. So there would be a place for me to recover before flying home. So I flew down to LA. I went 2 days early to kind of make sure that, the flight got me there and there was no hiccups. My best friend surprised me with tickets to the 49ers Rams game at SoFi Stadium 2 days prior to take my mind off of things. He's a huge Niners fan, and go Niners, they won, and a good time was had by all. The next day, we just sat around, you know, taking it easy, but I couldn't stop thinking about it. But I kept telling myself I'd been through this before. There were a lot of pre-surgery concerns, including paralysis, death. They put both at about 10 or 15% as far as the chance goes, which were higher than some of the risks I had been told earlier with previous surgeries. So I was a little nervous, but at the same time, I knew I was in extremely good hands. Dr. Barrell had not only shared my findings with other vascular surgeons on the team, but had been at a conference and shared them with 100 other vascular surgeons. And they all helped him draft a plan surgically for me. So I felt as good as I possibly could heading in to this surgery, but it still didn't help when I was awakened at 5 in the morning to get ready. I washed with my special antibiotic soap. Um, Antibiotic, that's not right. But anyway, the cleaning soap that specialized for surgeries. I went in, they, they clamped my spine to help reduce that risk of paralysis. But that really kind of brought it home for me that this was real. Um, and again, I got to use the line that I used at my aneurysm surgery, and it played as well this time as it did in 2016. Is they're poking around back there on my spine. It's kind of making my hands move and do funky things. And I asked the doctor, "You doing okay back there, Geppetto?" So anyway, the joke landed and kind of certainly lightened the OR, which I kind of feel like I'm the guy that kind of makes people laugh. So I felt if I kind of felt as normal as possible, that I would feel as normal as possible going through this. And a positive attitude I found is incredible pre-surgery with all these things, particularly with all the planned surgeries, even in an emergency surgery. I mean, that feeling that I will wake up, I really think helped me. And I've had surgeons tell me that it does help to have a really positive attitude. And I noticed that, one of the last things I remember before I was, out cold was there was a big computer off to the side, and what was open was Spotify, and it said Joel's surgery playlist. And I just thought that was hilarious slash awesome that, they were going to be rocking out while they were doing it. And I thought that was a good atmosphere as a huge fan of music. Um, who listens to music while he works. I felt, this is people that I could really, hang with. So I was out. I woke up in the ICU. I was told that my breathing apparatus would be taken out, uh, but I woke up and it wasn't. And I have this innate fear of drowning or choking to death. And I was really worried that if I woke up and it was still in my mouth, that I would start pulling at it. But I didn't. I was aware that that was a possibility, and somehow my subconscious had prepared me to be ready for that. And so that was in for about a day, because apparently there had been a huge amount of liquid that had come into my lungs. The surgery was supposed to take about 5 or 6 hours. It took 10. I was told beforehand, but it still didn't um, abate my shock at the surgical scar. Uh, it was from my belly button all the way up past my underarm to my back. So they basically cut that open and pulled it all aside, moved the organs to the right, and was able to cut through my ribs and get to the aorta and the abdominal aneurysm that they needed to fix. So I, needless to say, woke up in a lot of discomfort. The pain meds helped a lot, but it didn't help completely because I just felt off. It wasn't necessarily pain; it was just discomfort with how my body had, I don't want to say manhandled because I know they treated me with great care, but it was not a normal feeling. But they on day two was able to take out my breathing tube and I was able to breathe normally, but I could tell that there were issues with my lungs. And they checked my O2 and it was down to 30%. So they were greatly concerned. So they gave me oxygen, and that was not raising it. Um, so about day 3 or 4, they actually fitted me for a full head oxygen mask to help with that. And I'd say the biggest challenge in those first days was, and again, this fear of claustrophobia. Even though I was in this room, I felt trapped because of the spinal clamp. I couldn't move, which means I couldn't eat. I couldn't go to the bathroom. I couldn't do anything. But I had a catheter for the bathroom, so that was fine. And I had fluids for food, and I amazingly never felt hungry, which I think is extraordinary. But again, that's something to hopefully ease some people's worries about what happens in the days after a big operation like this. And I felt kind of, like I was going a little stir crazy, but the surgeon would come in and tell me that it went really well and that I should go easy on myself, because from where they're standing at the vascular surgery uh, part of the hospital, this was absolutely the most serious surgery that any human can endure. Um, which I know some people might make them a little frightened or whatever, but I took great comfort in that because I was alive. I wasn't paralyzed. And I knew that in, 48 to 72 hours, my spinal clamp would be taken off. And sure enough, it was. And I was able to sit up and I was able to eat. I just was given broth. Jello was fantastic. Um, ice chips were like the best thing I've ever tasted in my life. They really, really helped take care of that thirst. But there was a continuing worry about my lungs. And after another, I think, day or so, they determined that I had contracted pneumonia. And so they were trying to use, a spirometer, which I know a lot of us have used that have gone through this, but it wasn't enough. I wasn't coughing up enough. And they were getting more and more worried as that O2 meter crept up, but not anywhere near where they wanted it to. So they actually manually stuck something down, a tube down my nose and into my lungs. And I had to cough, and through suction, they ended up taking, over a 2-day period, 2 sets of bags, 4 bags each day filled with phlegm or whatever liquid, about this deep in each bag. They took 4 of those, and then the second day they took 4 of those. And then my O2 shot up to about 70%. And so they felt good about the progress. They monitored the pneumonia. But then it was that time, and I know some of you that have gone through this know it's I don't want to say something to dread, but they're really obsessed with getting you into the chair. And so it was time to get into the chair. And they turned me on my side. I used my arm muscles to kind of pull me up. But I knew they would be there because they had changed my bedding a couple of days prior, and I had used my arms to move me from side to side. So I knew that I had that upper body strength to do this. So anyway, I got put set up. Um, I stood up. Um, I felt pretty good, to be honest. I turned around and I sat in the chair. And they gave me my lunch or dinner, I forget which it was. And, it was still just broth and jello or whatever. Applesauce. I had graduated to applesauce. And again, best applesauce I've ever had. But I sat up in my chair, and then one of the nurses came in and said, in the next day or so, we'd like you to get up. We got a walker. We'd like you to get up and walk around the floor of the ICU. And I thought to myself, well, standing actually felt really good, and I didn't feel dizzy, and I just let it out of my mouth. I said, well, let's do it now. And they got all bug-eyed, like, okay, if you're up for it. And they got 2 or 3 other nurses to walk behind me to catch me in case I fell. But I made it around, a lap around the ICU, and almost immediately, one of the vascular surgeons on duty came in and just wanted to stress to me that couldn't be more impressed, and they were just blown away that I had gone from not moving for 5 or 6 days to sitting up, to getting up, to moving to the chair, to walking around the ICU, all within one day. And I just remember from previous surgeries that, the sooner you get to movement, the sooner you heal. That being said, that was great, but it didn't. I mean, I don't want to. One isn't related to the other, but and I ended up spending 20 days in the hospital, and that was largely due to the fluid in my lungs. They just couldn't get the last of it, and they were very concerned. So they thought that I would have another procedure that basically would open me up, and they would literally manually mop up my lungs. And they really didn't want to do that, but they thought that that was, something that had to be imminent. And then almost around that time, I started developing the most incredible pain in this area, kind of, or my ribs around this area. They did a series of nerve blocks, which helped a little bit, but within a few hours, the pain returned. And then they thought, we need a new CT scan. So they took me down, and I could not move past a 45-degree angle without excruciating pain. The worst pain I had actually ever felt in my life, and I know that's saying a lot. And they're just like, I don't know how to tell you this, but we have to have this CT scan. I don't want to be dramatic, the nurse said, but literally your life depends on it. And I still couldn't lay flat. So they, through IV, gave me a very strong dose of Dilaudid, and it kind of made me almost pass out, but it certainly made me feel good for at least 10 or 15 minutes to lay flat. They did a really quick CT scan. It got me back up and stairs into my bed, and came back with the good news that there was, the fluid had reduced to the point where they felt like they didn't need the procedure, the surgery, but then I definitely needed to stay in the hospital. So they monitored me for another, 8 to 10 days. They kept running tests. As also all of you know, sleep is a rare commodity in the hospital. They're drawing blood every 4 hours. They're checking your vitals every 4 hours. And of course, those two people are not synced. So, in an hour or two, they'd wake you up and draw blood. Another hour or two, they'd come back with your vitals. And it was nice to have the attention of the vascular team. But I was considered a subject for learning. So I found out that my surgery had been videotaped, and with my permission, which I gave, they would be using it at the med schools that they were connected to, and any other schools that would want access to this surgery, again, because it's the most serious that they do. So I had med students coming in and checking on me, and they start their days early. So at 5:30 in the morning, I had 5 or 6 med students coming in, hovering over me, checking my pulse, checking the feeling in my feet, checking my lungs. And then my regular doctor would come in, kind of monitoring my medicine intake, prescriptions, my heart rate, lungs checked. And then the vascular team would come in at 7:30. So I felt very well taken care of. And I think this is probably a good time as any, and I think many probably feel this way, but I just marvel, and I have for the last 7 years, at the institution that is our nurses. Nurses are absolutely incredible. I don't want to say it's a thankless job, because I certainly thank them quite profusely. But they're working these 12-hour shifts, and they are right there when you push the button as soon as they can get there. They are, I don't want to say obsessed, but certainly very concerned about your pain level. So one thing I can certainly recommend for anyone going through this is, don't be afraid to ask for help with your pain, and certainly don't be afraid to ask for help with anything. They kept stressing, not to lift anything heavy or anything more than 2 pounds. So even if you need help sitting yourself up, because you kind of slide down as you stay, hit that call button. The nurse will grab the sheet or whatever and lift you up to a more comfortable position. And don't try to do it on yourself. Don't try to do anything by yourself. This is what they're there for, and they live for helping. That's why they got into the profession. So anyway, at about the 18th day mark, they start talking about discharging me, and that uh, there's a certain amount of fear that kind of comes with that. Like, you've had this cocoon that you've been living in, and everything provided for you, from your food to, people that give you what, as much as you can get clean. Yeah, no showers for 20 days. And I'm a guy who likes to shower every day, and I was amazed that it never bothered me. Uh, but the nurses did a good job of keeping you clean, keeping you sanitary. But I was worried about having to do it by myself, but I wasn't necessarily by myself. I had my friend. And it's really important, if at all possible, to have somebody or several somebodies who can look in on you, who can help you shop. In today's day and age, I had a Walmart delivery waiting for me when I got to my friend's house with easy to make foods, um, and beverages and drinks, and tried to stay healthy, fruits, etc. And sure enough, day 20 came, and it's always very sudden. They came in at 11. They're like, "You're getting out today," and I'm like, "Wait, what?" Um, but this is good news. I mean, this means that you have successfully navigated the hospital portion of your recovery, and the next chapter of your life is set to begin, which was heading home. And my friend picked me up and drove me home, or home, drove me to my friend's house, where he was about as giving as you could be. There was an air mattress there, and I had talked to a fellow survivor who had a similar surgery. She had portions of her aorta replaced 6 years ago, and it's amazing the technology that's advanced in 6 years. But she had said that an air mattress was actually a welcome thing for her. She actually went and bought one because she felt the bed was too hard to get up from sitting or laying. And there's something about the air mattress that kind of bounces you up out of bed. But that being said, my friend insisted that I take his bed, and he had one of those beds that kind of raise you. So it kind of served that same purpose. And so I was very comfortable there. Not much to do, but kind of rest, recover. I had been authorized for home health, so a home nurse came after a certain amount of time, maybe 6 days, I think it was. I had my first PT and OT come and visit me, and so we were doing very small, limited exercises in my friend's house, and that really kind of helped a lot. But it was supervised. But what was incredible is I developed a double hernia. So that was something to kind of circumvent, to deal with PT. And then also something that became apparent was that my left middle ribs were healing off, for lack of a better word. The incision mark was right there, but there was kind of like a reverse, for again, lack of a better phrase, a reverse upside down hot dog bun. It was that exact length, and it was hard as a rock, like it was my rib, and about 3/4 of an inch to an inch below was the rest of my belly. So I knew that wasn't quite right, and it really hurt. And finding a comfortable position was impossible. But the physical therapy people were very sensitive to that and to the hernia. And next thing I knew, it was my follow-up appointment with my vascular surgeon, and I visited with him. He checked me over top to bottom, and he felt that the surgery was a great success. And he even said, forget superheroes. You are the real Iron Man. I just am so impressed. And can't wait to use your case as a case study with other doctors and patients that are getting ready for this surgery, to talk about what you did and what you went through and what is possible after such a major surgery. And, you're okay to fly home now. And that he wanted me to meet with a primary care doctor and my vascular surgeon as soon as possible when I got home. And so I arranged for a flight the next day. He told me I would definitely need to request a wheelchair, and so they would carry my bags, etc. Because I had heavy bags because I didn't know how long I would be there and I needed clothes, etc. My friend carried my bag to the airport for me, and if you can get somebody to help you, if you're flying from your surgery, otherwise, obviously, whoever picks you up will help you with that. And sure enough, the hospital people, or hospital, guess I have hospital in the brain. The airport people were right there at the door. That's where the wheelchair people are. And I said, I prearranged a wheelchair. They checked my flight info, and I was sitting in a wheelchair before I knew it. And they had a place under the wheelchair for my bag. And so they wheeled me through security to my gate. And that provided another opportunity for the lesson of be your own best advocate. I was dropped off at my gate. I was 2-3 hours early for my surgery. There was nobody at the gate. There was even nobody sitting around me. I was definitely the first one. And then I looked up at the gate sign just to check the time, and it listed a different city than the one I was flying to. And I got a text from the airline saying that my gate had changed all the way to the other end of this part of the airport. I didn't have a phone number for anybody at the airport to call, but there were other gates, 100, 200 feet away that were handling other flights. And I literally yelled, as if my life depended on it. Could someone please help me? And you got to, literally speak up for yourself, even if it means yelling for yourself. And so they came over and they're like, what do you want? But like, I was sitting in the handicap chair. So they contacted the wheelchair people and I got to my proper gate. And then again, the airline people are trained for this. They know that we've all been to the airport. They're like, anybody that needs extra time or is handicapped, and you may not think you're handicapped, if you're feel, like the surgery was success, but you're not supposed to walk too much or carry your own stuff. And so, ask for this. It's there. The airport, the airline, they all are used to this. They've encountered all kinds of people that need all kinds of help. So when the time came, I got wheeled on to the plane right to my seat, and I was able to just sit in my seat. And they put my carry-on underneath my chair in front of me. And the doctor had stressed that getting up a couple of times during the trip was important because they didn't want me to get a blood clot or another blood clot. I forgot to mention that. I got a DVT here while I was in the hospital. But then again, I got a blood clot with every surgery I've had through this process. So to me, it wasn't a big deal. I was already on blood thinners. I wasn't a fan of the blood thinners. I was on warfarin. And everyone in Cedars-Sinai recommended I go to a different one, Alias, I think it's called. And so I was on blood thinners, but I also knew to get up and just do a lap up and down the airplane. So easy flight, landed in Spokane, and waited for the plane to deplane, and then the wheelchair person came on and got me, wheeled me to my gate, and had a reunion a month in the making. My daughter, 10 years old, was at school, but my wife was there, and her parents, my mother and father-in-law, were there to help with everything. I got driven home. Within half an hour, my daughter came home, and when you have loved ones waiting for you at home, it just kind of is really extraordinary. And at the same time, it's inspiring. you're in a new chapter of this recovery. You're now home. And there's a daughter or a wife or a friend or whoever's there to help you, or someone who loves you. And these are the people that I found inspiring to work hard, uh, but then again, not too hard because you don't want to overdo it. And especially me with a double hernia, which loves to rear its head at the most inopportune times. Uh, but I knew to take it easy. I met with my doctor. Again, you got to be your best advocate. I called to get the first appointment I could with a primary care, with the vascular surgeon, and with my cardiologist. And I came home probably uh, August 8th, I think it was, or October 8th. And they were telling me that the first appointment they could get for any of these people was mid-November. And I just spoke up. Just said, that's unacceptable. I just had an incredible vascular surgery. I look like I have a shark bite on me. And they said, oh, okay, well, you didn't tell me that this was ASAP. So that's another, lesson I can impart is, you got to speak up. You got to let people know they can't help you if they don't know you need the help or the attention. And so they couldn't get me to see my primary care doc, but they could get me to see, a doctor for a post-op to address medication issues, and anything that a doctor needs to know. They can get it on your chart for everybody to have of record. So I was able to see this doctor, I think 5 days after I got home. And he made it clear that he would not be my primary doctor, uh, but that he was seeing me because it was important to get in with a medical professional. And he was great. He took down my medical. I was on probably 7 to 10 different medications before I left. And after the surgery, I was now up to, I think, about 18 or 19 different medications. So we updated the medication list. Was extremely important because when you need those refills, it can't come out of left field. The pharmacy is not going to know. This was something prescribed to you in the hospital. And if you're like me, it was in a different city. So it was very important to demand that first doctor's appointment. And it worked out great. He blocked off a half an hour for me, which for doctors I think is amazing in this era where doctors can be, rushing you. And regardless of where you are in this process, don't let doctors rush you. We are a unique bunch who have aortic issues, and we've been repaired, and we may feel better, but we still need the attention, the care, and the sense of urgency from a doctor. And I felt like I got that from him. And I realized that, seeing a doctor was important, but also getting in with the vascular surgeon who was treating me up here, but didn't perform the surgery was extremely important. So I called them back and stressed how important it was to get in. And I got an appointment that was several weeks sooner than what they had given me. And the same thing with the cardiologist. In fact, I saw the cardiologist on one day and saw my vascular surgeon the next day. And the cardiologist had requested an EKG and an echo to have her most up-to-date information and imaging for herself and all the doctors up here. And then a CT scan was requested by my vascular surgeon so that he had all the updated information, and we had the most up-to-date post-surgical CT. And they were several things. There was the bottom tree, he called it, of my aorta that came off my aorta was not getting blood to my spine, but that what they had left of my false lumen from my aortic dissection, and they had repaired it during this most recent surgery, had been providing the blood necessary. So they wanted to keep an eye on that, and that is certainly something to worry about, but I feel confident about it because the doctors are on it. And my surgeon was amazed, and he, uh, knowing my situation too, had brought in 4 medical students uh, to have a study of me, and um, one of the first things he did is he wanted them to see my scar, and all 4 said that they had never seen anything like it. So I feel like the more we can educate not just patients and soon to be patients of surgical intervention, but the more we can educate doctors and honestly, especially medical students, because they'll be heading into their medical career with the knowledge about aortic issues that they might not get to the extent that the real life survivors can provide. And so whether it was in my 20-day stay in the hospital, random medical students coming in at any time, can I talk to you? I'm like, absolutely. And so my, surgeon up here in Spokane had 4 medical students that were very educated that day. And my surgeon took 30 minutes with me and was very detailed and had a theory about my ribs that there were either two things. Either 2 ribs had kind of healed on top of each other, which is fun. But I like to joke that they were in love. So what better way to just kind of heal together? Uh, or it was very hard scar tissue, and he said that nothing would reveal what it was. In fact, other than time. And as somebody who's been told that recovery from this surgery, I guess it's a situation, would take 6 months to a year until I felt normal, whatever normal is. And I know a lot of us uh, talk about a new normal. So I am armed with that mentally, knowing that this is going to take a lot of time, and that I feel better. I'm now I'm a full 2 months out from my surgery, but I am still in a lot of pain. I'm on pain meds, which they say I should be on for even another month or 2. But everybody's well educated about what I'm on, and they're ready to wean me off them when the time comes. But for right now, as a surgeon said to me when I visited with him up here, this is not the time to treat my situation with kid gloves. That being comfortable from the pain is much more important than worrying about uh, potential addiction issues. And since I've been on pain meds before and gotten off them many times, they weren't necessarily worried about that with me. But it is something to certainly be aware of. But communication with anything in life is key, and it's certainly important with your doctors, and that they know what you're going through, and there's a plan in place. And I mean, they've given me gabapentin and told me that that's less addictive, and that's something that I can take when the pain isn't so bad. And they have me taking Tylenol, but certainly keeping track of the Tylenol because I'm on pain meds that have acetaminophen in it. So I take notes so I'm aware of what I'm taking when, so that I don't take too much acetaminophen, and I know myself to kind of gradually reduce the pain meds as I'm in less and less pain. And I think that in terms of recovery, I still have uh, PTSD from the initial dissection, the emergency dissection in New Orleans, which is now 7 years ago, 8 years ago, goodness. Um, and it's not necessarily anything that's arisen from this surgery. I'd say that the experience of that was invaluable, going through such a serious surgery and recovery in the hospital over 20 days, that mentally it helped. It was priceless. But I'd say that the PTSD is rearing its head since I got home in the recovery, because something that's happened is no matter how long I sit, even if it's for 10 minutes, when I get up, there's a feeling that emanates from my belly, from behind the surgical site, and it goes down my legs, and I feel like I'm going to fall. And that is a trigger, because that's exactly what happened to me when I dissected. I had spaghetti for legs, and I fell. And I don't fall now, but I definitely need to grab onto something. And it's something that my surgeon and cardiologist and primary care doctor are not necessarily worried about, uh, but I am very worried about it. And it brings me back to uh, New Orleans, the ambulance, the sound of the siren going. But I've also talked with a therapist for many years, and I know and have the tools to combat the anxiety that the PTSD can bring. And I can't stress enough that, if you feel anxiety or PTSD or anything in that ballpark, uh, to ask for help. That help is key. That there are even apps to help you deal with PTSD, and at the least look into that. But it's always important to let your medical professionals know, and they can refer you to a therapist and somebody that is well trained in this arena. There's medication I'm on still since 2015 to treat anxiety and depression and PTSD. And they say I may be on it for the rest of my life, and I'm prepared for that. But the key is asking for help at the onset. So for me, the PTSD is not really anything to do with this most recent surgery, except for the recovery that has happened with my legs, um, and that concerns me. And I don't fall, but if it gets worse, I'm definitely going to be in touch with my vascular surgeon and try to figure out what is going on. So again, I'm going to be my own best advocate, and that's the best you can do for yourself. It's the best gift that you can give yourself, or anyone can give you, is your ability to speak up, whether it's mental health, physical health, physiological help. It doesn't matter what kind of help it is. If you need it, you need to ask for it. And sometimes people don't hear you, so you have to ask again. And I'm going through that right now. I'm supposed to be getting home physical therapy. I got it in Los Angeles, but I haven't even started it here. And I've been home for 5, 6 weeks. And it first took them forever to get it authorized. And then it took them forever to get it scheduled. Uh, I finally had a home nurse come visit me. She had me set up with OT and PT. And then I went to the hospital because my pain was really bad. Found out that it was an infection. They gave me antibiotics. I went home. And the next day, I tested positive for COVID. So PT had to be put on hold. I tested negative for COVID 4 days ago now. Yesterday, I called the PT, the home care people, and they said I would need another referral because the other one had expired. So I'm not waiting for my primary care doctor to do the referral. I called and insisted on speaking to him and get that referral ball going because, the vascular surgeon, when I met with him last week, stressed that PT is key. PT will help the pain. PT will help your healing. And so I am being the squeaky wheel, and it's the days before Thanksgiving. I'm aware of that. But my doctor needs to get that referral going, and insurance needs to approve it because I want PT to get going next week. Um, so, again, be your own best advocate. Be prepared for everything. And if it ends up being nothing, all the better. But you can, even if you have nerves heading into the hospital for a planned surgery, you can ask to talk to a therapist beforehand. I know I did for this one. I feel like I was given the tools for PTSD, but it didn't change the fact that I was scared silly about being paralyzed or dying from this surgery. And so I had 4 appointments with a therapist. And I believe that, again, to use this word, I felt like it was priceless to help me be ready for the surgery. And again, to be mentally positive before you head into the surgery. Doctors have said that also is priceless. So ask for help before, not during the surgery, obviously, because you can't, and after, whether it's the nurses in that call button, uh, surgeons for concerns you have at the hospital, or a therapist or doctors when you get out. Uh, Being your own best advocate is the best advice that I could give. And it has really served me well. And believe me, if my legs continue to scare me, I will revisit my vascular surgeon to try to figure out what is going on. Even if it isn't a dissection or anything like before, it's not normal, and I shouldn't have to live with it. Every time I sit up, I have to wait 25 minutes to hold on to something. That's just not normal. So uh, I got my eye on that, and I can't stress enough. Talk to your family and friends if you are lucky enough to have that, uh, beforehand and after, to ask for help, and beforehand for support. And I had many visitors in the hospital, and that was also just incredible. My first time, because I was in a different city, I didn't have that. But, there's the phone, and that was also very helpful. So I guess if I can leave you with anything, it's again to stress: be your own best advocate. Always ask for help. If you don't understand something, ask them to explain it further. Um, do your own research, but don't be a Google MD. Definitely look to the experts, and certainly the experts online are, Cleveland Clinic, Mayo Clinic, Cedars-Sinai. Don't just look at random sites, and don't let those be gospel also. Seek out your own medical professionals, and they can set you straight. And depression, a lack of interest in doing things, those things can happen, and they have happened to me. But I've sought the help. I've talked it out. And also movement. That's another reason why I want PT to get going. Is exercise is proven to be a great tonic for depression and helplessness. And the sooner you can get PT going, is the better. And I even, I must look like a crazy person if you map me on a GPS with my phone. I'm doing circles around my basement or my house, and it's just what I can do right now. It's freezing outside, and cold isn't exactly the best thing. So I walk around the house, and until PT gets going, I'll keep doing that. So, one more time, be your own best advocate. Um, Also, this group, Aortic Hope, and uh, aortic survivor, aortic dissection survivor group. There's a lot of support groups out there on Facebook and elsewhere, and they have really been an incredible help to me. And it's such an incredible community. And I thank God that I found this group. And I believe that the universe. I also believe, that fate is a piece of the pie, and that they brought me to this group. And I thank the heavens above that I camaraderie, and I can reach out to people on DM and ask advice about something. And I can't tell you how many times I've said, "Oh, I think I have this," or "I have a high blood pressure," and I've reached out to anyone in the group that I've gotten to know, and they say, "Go to the ER." And sometimes you just need that push, and they provide it. So again, that kind of the theme here is ask for help, and don't be afraid to ask for help. And again, my name is Joel Amos. I am a part of this group. I would be more than happy to help any of you that have any questions about anything you're going through. I have had a number of the surgeries that many of you may have, and I would be more than happy and see it as part of my mission in recovery to help all of you. So I hope my story was helpful, and also interesting and compelling. And I look forward to kind of keeping you posted as this 6 months to a year till I feel normal progress. And until then, I wish all of you the very best, and all the best for the holidays, and happy Thanksgiving, and whatever may come your way, may it be the best, and may you all be blessed. Thank you so much for listening and watching, and hopefully I'll see you all in the Aortic Hope world.